I'm Dr. Christopher Barker, and welcome to Holding Space. If this is your first time with us, I am a New Jersey licensed clinical psychologist, and I have guests on to talk about the different things that they do, and we can compare perspectives. Today, I have Bret Boatwright, who is going to talk to us about the issues surrounding working with adults. And do you do children also with neurodivergent issues?
I mostly work with adults. There's occasionally times where teens might be brought in. Mostly people that I work with, I divert that to just because I think there's different considerations involved in different stages of life. But I do really like focusing on adults, and I really focus a lot on the self-image aspects of it, is most of my work, I would say.
Yeah, I think that's important. I have a couple of people that I work with who are on the spectrum, and as adults, they not so much struggle with the idea that this is what they're dealing with, but also just like navigating the world. And I know neurodivergence is a pretty wide gear, and there's a lot of different things that fall into that heading. And certainly, it's often in the news these days in terms of like at least in the clinical news, in terms of what people are working with and the issues that we're confronting and dealing with it. So, again, I defer to your expertise, and if you want to tell us a little more about what you do, what your passions are, what's current, what's happening.
Yeah. I'll honestly just start with a little bit of my own background. Part of what kind of drove me this route was that I myself was diagnosed with ADHD very early. It's very much held true. And I think something that has always been a difficult contrast is struggling with all of these things that are basic expectations of me while simultaneously knowing that I'm quite capable at the same time and really running into both a lot of trouble and praise at various points. But I think emphasis tends to be on the trouble. And I think the realization of that really didn't hit until later in life for me. Like, yes, I had this diagnosis, but didn't really think a whole lot about it. And then I think at some point later in life, I really started to process what these differences meant about me and my world and how I relate to other people, and how it's not just a thing that I have on a piece of paper somewhere. It's something that really informs all aspects of my life in a really big way. And as I was going through my own clinical training many years ago, I really started to run into a lot of these issues at a much higher level now that things are getting much more difficult. And I think it really made me reflect a lot more and a lot deeper. And one of my placements back during that time was actually working with teenagers with autism and ADHD. And I think that for me, that was actually a healing experience that allowed me to kind of be the support I wish I had when I was younger. And as I reached adulthood and really started to contend with a lot of the ways this affected the way that I understood myself, I realized that I kind of wanted to help other people navigate that as well. And I think the first place to really start with that in terms of self image is what's oftentimes called rejection sensitivity dysphoria. I think the way I define it might be a little different than most people, but I think in my experience working with it clinically, there is just this constant experience of rejection and criticism. And whether or not you receive that diagnosis, you're having that experience. You have social problems, you're getting criticized by peers, you're getting bullied by peers, especially children with autism, I find. ADHD, there's constant chastising from adults and not a whole lot of supports. And there is also some differences between men and women on that I think are really worth exploring as well. But the thing is over time, these things really stack up. Children might lack a lot of reflective capacity, but they can tell that they're getting a much harder time than anyone else is around them. And that really deeply affects the way that they understand themselves. And by the time you reach adulthood, it's really interesting. You can have somebody who's really confident outwardly, somebody who just seems like have it together and it's normal. And then suddenly, I don't know, they miss a deadline, they forget about something, someone says like what seems like a small criticism, and they just collapse. They fall apart. Maybe not outwardly, sometimes it's just inward, but there is this really deep seated self hatred that seems to come almost out of nowhere sometimes. And it's really interesting where someone's life is so together and so normal, and then suddenly the way that they understand themselves just implodes almost instantly. And because of that, I think it's a really different consideration than most forms of anxiety, depression, these sorts of things. It's just such a deep seated self hatred that is invisible until suddenly it's not. And I think with that, something that I was discussing not too long ago was that label or no label, you have all of these experiences, you get treated in certain ways by the people around you, and it's all pretty consistent. And the thing is I don't really like the term disorder so much. Not with this stuff. I like to use the word neurotype. I like to think of ADHD and autism as different ways of feeling and seeing and experiencing the world. I actually think there's something very beautiful to that. And I think the issue to me is more how a society interacts with that. I think that a lot of the things we look at with this stuff is we're looking at how somebody deviates from normality. And sometimes when we are looking at that, we are labeling things as wrong that are really just differences that don't ultimately hold the real moral value that actually needs to be an issue, but people are taking issue with it. And sometimes there are real weaknesses. Like, obviously, there's real challenges with short term memory with ADHD that I'm all too familiar with. But at the same time, there's also a lot of strengths too. I think people with ADHD might really struggle with short term memory, but a lot of them are extremely passionate people that can really focus on a topic and learn quite a lot about it when they want to. The issue being that that's very hard to control.
Right. And I know both my sons have ADHD, and they're adopted. They're from different backgrounds and everything. And so the manifestation is different. My youngest son also has bipolar disorder. And again, I mean, there's what we observe. I know that it's really difficult. My oldest son has a really hard time with it in terms of the things he's fascinating with is also fascinating. He is totally focused on, but the things that he doesn't think are important are just kind of like not even in vision. They're not anywhere near him. So I mean, again, it's kind of a matter of learning to navigate life, learning what your strengths are, what your limitations, if you want to use that word, are in terms of what you can focus on and what you can deal with. Rejection sensitive dysphoria is definitely a thing. I read something recently that there's something of a backlash against that term these days. A lot of people are just like, oh, that's just people having tantrums. It's just people having trouble getting along. And I definitely don't agree with that. But I mean, I'm sure you've heard that also.
I actually have not run into that one. I hear backlash against various things at different points. I tend to move away from the word disorder and disability. Some people feel more strongly clinging to it, even within the community. And I think people have very valid concerns about a lot of this stuff. But I do think that for me, listening to the people in these communities that actually experience these things is a lot more enlightening than people outside of it applying their own frames without really understanding what the experience is like.
It's a really important definition and distinction.
Yeah. And I think, especially if you're just reading about it, I can see why somebody might draw those impressions. But I think trying to apply conventional understandings of depression and anxiety has never been something that I think fits whenever I'm talking about rejection sensitivity dysphoria. And I think, especially in the cases that I've had, that it's been really acute in particular, it feels very, very distinct.
Yeah. And again, you make a good point. I think any kind of psychological issue, if seen from the outside, people are just like, well, why can't you just get over it? Which I'm working on a book now talking about a lot of this, and one of the things that I cover is the language that we use, and trauma informed language, and
Mhm.
I mean any kind of, if it's not disorder, any type of difference informed language. We have to realize that the things that we say make a difference, and they're sometimes subtle, and the impact always is huge. And
Mm.
especially for those of us working with it, I think we have a different perspective, and certainly a more sensitive perspective towards what people are dealing with. If you have any particular cases that you can discuss, or issues that you're seeing that you really want to see change? And that's important. What do we want to change out there now?
Yeah. I mean, for me, I've kind of already alluded to this, but just the framing is the main thing. I think when we talk about any human being on earth, there's no such thing as a perfect person. We all have our strengths, we all have our weaknesses. And for me, that is also equally true of every neurodiverse individual. And I think that the issue to me is less about the different weaknesses that they have. I mean, you should know those things as a clinician, but it's really more about recognizing that there is a friction between the way that society is structured in terms of what we tolerate, what we're willing to accept, how we're willing to understand differences, that to me is the chief cause of a lot of problems. Um, I think for some individuals, maybe they have certain sensory sensitivities or other things that are truly so severe that it would be fair to use the term disability. But for a lot of other folks, if people just gave them the basic grace to show up a few minutes late to work when they have ADHD and maybe to feel a little bit overstimulated in a certain circumstance and it be socially okay for them to separate and to come back when they're ready or to structure their schedules in certain ways, just the ability to respect that there are certain differences in what people's needs are. I think that a lot of those issues would not be nearly as present as they are. And to me, that is the framing that I think is missing. The other framing I think is missing is process. I think that we are so focused on behavior. I think that part of the problem with that is actually the male female thing I was kind of mentioning earlier. Men and women show ADHD and autism in different ways, especially as children. Um, and consequently, all of the early samples for how we define what those quote unquote disorders are based on young boys. And as a consequence, a lot of women just get missed diagnostically early until much later in life, and maybe they never get diagnosed. And also, again, because it's focused on children, I think it's much harder to diagnose later in life if you don't know what you're looking for. So, the ability to recognize what's happening internally for a person and why they're engaging in the behaviors they're engaging in is a lot more informative and enlightening. I think a really good example of this that tends to come to mind is reading. So for young boys with ADHD, they just a lot of times can't really focus on the reading. They're looking away. They put the book down. They're trying to talk to somebody. Who knows? For girls, a lot of times girls are put under a lot more scrutiny around their behavior. So as a consequence, what they oftentimes learn to do is stare at a book and pretend you're reading. And even though you keep spacing out and you're losing it and you forgot what you just read and you have to go back and read it, no one notices because it looks like you're just reading. And no one's actually checking in to make sure that you're retaining anything in front of you at all. And to be honest, I think sometimes the comprehension ends up being a lot worse in that setting with ADHD because stimulation is such an important factor and staring at a page is pretty understimulating.
Yeah. And if no one knows exactly what you're doing, they're not going to say, "Hey, get back to task." And so again, they could skate by for a while. In fact, a couple of people that I've worked with, who have realized later in life that what they were struggling with all along was ADHD or some form of it. I mean, they used to differentiate and say ADD and ADHD, but now, folks, it's all ADHD and it's inattentive type or mixed type and or hyperactive type. But again, it's kind of like so. I finally figured out what's going on with me, and the one woman that I see, she refers to herself and her kids as neurospicy. That's her take on it because we're a little different from other people, but that doesn't make it bad. And
Yeah.
it's true.
And that's my feeling on it too. And neurospicy is another term I've seen have some controversy within the community. Some people really like it. I think it's kind of cute, but other people find it to be annoying as a label that is often they feel applied to them. And I think that's an interesting thing about just being a part of these conversations with all sorts of different people is they have such different things to say and experiences about what it's like to experience these things. And that makes it certainly hard to talk about as a clinician where you're supposed to have, I don't know, these clear cut explanations about how to and not to talk about things and all of this stuff. But I do think a lot of times just It's really more about entering someone's world than anything else and figuring out how to resolve a lot of that friction. And I do think the friction between self and society is the big one. And especially with folks that go undiagnosed, an issue that comes up is that their behaviors are moralized in a big way. And to be honest, they tend to be anyway. But if you have a diagnosis of ADHD and people are giving you a hard time about being lazy all the time, it's a little bit easier to recognize that maybe you're not being lazy. But that said, if you don't have that diagnosis, you kind of start to believe it. And consequently, a lot of times people with autism think, oh, I'm just like a rude person. Or people with ADHD think, I'm lazy. I don't actually care about things. But like, that's often not true. People with ADHD are often some of the most passionate people out there. And I do think that a lot of these labels that people apply by kind of using this frame of what a normal person is supposed to be like ends up doing a lot of harm just because there was no effort to recognize these differences early on and give someone a frame to understand themselves that allowed them to build themselves up rather than allow themselves to be teared down due to this lack of understanding from other people and frankly also from themselves because they just never had that frame given to them.
I've had, I know this is true for my sons, and I've heard this from a variety of other people too. A lot of people with ADHD have been accused of being liars. My perspective on it is if you only are picking up half of what's going on, or if you're trying to compensate and you're trying to function in the world as if you know what you're doing, I've heard it compared to if you go to a movie theater in a foreign country, you won't understand the language, but you'll grok what's going on from the screen. You know, you'll come up with a story about what's going on, and it may actually be accurate. It may be a little variation from accurate, but coupled with behavioral manifestations, it's I think a lot of parents just believe that their kids are liars, and that's just something I have to correct with them. It's a difference in perspective. It's a difference in what they are able to understand and perceive, even.
Yeah. And I think that's one aspect of it. I think what you said absolutely applies. I also think that sometimes people aren't receptive to hearing that someone didn't hear something. So again, the moralization, they think, oh, you weren't listening to me. And they're listening as much as they can, but they're really struggling. And a lot of times there's also an expectation to be guilty about these things all the time, to be, contrite and all of this stuff. But you can't just be guilty about everything all the time. It's not really fair, especially to these kids. And consequently, what ends up happening is they will end up saying, like, yeah, I definitely heard that because they're afraid of the way that you're going to react when they say that they didn't catch it. And sometimes they did catch it and they genuinely intend to do it. And then the executive functioning breaks down, they forget about it, they lose time. And they genuinely meant to the whole time, but they're a kid and they don't really understand how their brain works quite yet. And it slipped their mind, but they genuinely meant to. Um, but the sort of anger responses around that a lot of times can be, I think, quite harsh on their sense of confidence and sense of self.
Really good point. Yeah. I think that is something that gets impacted regardless of what kind of disorder issue a person's experiencing, whether it's anything from depression or anxiety to a learning disorder.
Mm.
It's kind of like the feedback that you get from people really impacts your self-esteem and impacts the way you see the world and how you interact with other people. You go in a little bit more cautiously, or you go in not expecting good things.
Mm. Yeah, and just kind of transitioning away from, before I transition away, actually. So, I'm putting identity on a lot of this. And I do think that's ultimately a very large portion of my work. And one framing that I actually personally favor, which I think differs from the way our field tends to view diagnoses, which is I think our field tends to like to say, I have something. I have depression. I have anxiety. And in those cases, I actually think that's fair. Those are temporary conditions. They aren't defining you necessarily. And they're things that you can work on and build around. And, ideally, you aren't depressed one day. Ideally, you aren't so anxious one day. I don't think that's true with ADHD and autism. It's something that you always have. It's something you learn to kind of compensate for your weaknesses, emphasize your strengths. Like, that's the ideal. but it's never going away. And it's not just never going away, it's something that frames your entire life experience. It frames how people treat you, it frames how you understand your relationships, it frames how you feel your emotions, it frames executive functioning. It truly affects anything and everything. And I think trying to frame it as this thing that's over there that, is just a problem that you have, I'd rather frame it as a thing that you are and that there's nothing wrong with that. And that tends to be the direction I like to go.
Yeah. It's a lens through which you see your world and through which your world sees you too.
Mm.
How do you work with someone who comes in as an adult and says, "Hey, I think I got this thing"? What kinds of approaches do you take? Because it's different for adults. I mean, with children, there are services that are involved. There's a paradigm,
Mhm.
but for adults, it's much more subtle.
Yeah. I certainly have kind of my own broad therapy leanings, but I find with ADHD and autism in particular, I lean very heavily into identifying the language that people use to speak about themselves and using that to really make sense of what all of these kind of underlying things are. Like, how do you frame your understanding of yourself? What are these labels you apply to yourself? How does your mind react to criticism in these situations? Like, what are the types of thoughts you're having? Like, all of these sorts of things. And I really look early in life and I identify like different experiences that contributed to where this comes from. And I also provide reframing around this is how they treated you, but like, I really think this is what happened. Just trying to provide a corrective experience. I focus a lot on strengths. I try to be very validating of the negative experiences. I try to really help someone recognize all of the really great things that they have to offer and try to just really fundamentally break down all the self-image aspects they have, or the negative ones at least, and kind of reshape them around the way that I think that they are authentically and the way that they could become, like you could say as well. Because there's so much, I think, of an identity built around almost brokenness and unfixability and something's wrong with me. And instead, what I want to do is say, like, you were different. The way people treated you was not fair. And you have a lot to offer. And, it's going to be tough sometimes because people aren't always going to respect your differences. But that's okay. And as long as you are somebody that is willing to own those differences and make the most of your time in this world, that doesn't mean anything's wrong with you.
That's a really empowering message, and I think that would be good for people to hear and sort of relax into the idea of, okay, this is who I am. And it's not a bad thing necessarily. It's just
Yeah.
who I am. It's important.
Yeah. And, there's way more things than I think I could ever truly get into with that. But, one example, there's a line of research that's been happening for, I don't know, 10, 15 years now. And it's kind of just focusing on autistic communication. And this is, I think, a really good example because we a lot of times look at autism and we look at the way that there are all social difficulties. And the thing is this research is kind of indicating, well, no, not really. The issue is almost a cultural difference, you could say, an innate cultural difference, but a cultural one where the way that relationships and social interaction are understood are so fundamentally different, but also sufficiently consistent that if you had a room full of autistic people, there are no social deficits. Room full of neurotypical people, no social deficits. But if you put a neurotypical person with a bunch of autistic people, guess who's getting labeled with social deficits? It's the neurotypical person. Versus the context where we always look in the reverse of let's throw an autistic person with a bunch of people different from them and they have difficulties. So it's one of those things where I think we could say autism has social deficits, or maybe they have social differences. And this is one of those instances where I think differences is pretty clear. Um, so it is just one of those things that the way that we understand these things sometimes isn't always totally clear until we really start challenging our assumptions in that way.
Yeah, I like that. I really like the culture idea. That's a good way of looking at it. Thank you for being with us today. I really appreciate that. But again, if you have any books, articles, if there's anything you want to point people to, please let us know and we'll attach it.
Yeah,
But
I might
I
send
mean,
some stuff along. certainly what I just mentioned about communication, I think I could probably find that study or studies. But yeah, thanks for having me.
Yeah, no, thank you. Again, Dr. Boatwright, thank you and if you like this sort of content, hit like and subscribe, and we will continue to present new and interesting ideas.
Yeah,
Thank you for
happy
all
to
the
be a
today.
part of it.
Thanks.